great question. You know, in the old days, vaccines were pennies a dose. So if you think of polio vaccine or measles, rubella, the diphtheria, pertussis, tetanus vaccines, these are very cheap, inexpensive vaccines that save millions and millions of lives. As new technologies evolve and requiring more expensive techniques, the prices of vaccines certainly go up, and that's what we're seeing with the newer vaccines. With the recent addition of hepatitis B and Haemophilus influenza, both life-saving vaccines, particularly Haemophilus influenza type B, which cause meningitis and invasive bacterial disease, we've been able to keep the price down with our PAHO revolving fund, which buys vaccines on the behalf of the countries, because we negotiate a unified demand, what we call bulk purchasing. So all the countries give us their demand, and then we use the sum of the whole region to negotiate a more affordable price. So the more doses you can buy, the company then sees an opportunity to bring down the price, and it's win-win for everybody. But even then, with that sort of mechanism, the newer vaccines that tackle diarrhea and pneumonia in children, two of the biggest killers of children less than 5 years of age, so specifically the rotavirus vaccine and the pneumococcal vaccine, these are dollars a dose, no longer the pennies a dose. And in the case of rotavirus, it costs about $15 to fully vaccinate the child with that vaccine. Now recall that with the older vaccines that I mentioned, on average it costs maybe $24 to vaccinate a child, the total price of the vaccines. So now so 24 and you add 15, you see the impact that has on a budget. So what we need to do with these newer life-saving vaccines that are critically needed in order for countries to reach the Millennium Development Goals, particularly MDG4, the child mortality reduction goal, is that, you know, they expand their fiscal space. They look and identify opportunities that will prevent a zero-sum game, so that they're not taking from the malaria program or the HIV program. They're actually expanding their budget, their fiscal space that we refer to. There are a number of ways they can do this. They can get new donors, or they can create laws that maybe would take the tax off importations of vaccines. In some cases, we saw that it might be half the vaccine price. So if you can omit and give an exemption to the importation of that particular vaccine, then you have that money to invest in more vaccines. So just to cite a few examples of what countries need to do or could do. The other is vaccine laws. We have countries, some probably more than 20 countries, that have a law that recognizes vaccination as a public good. It's a child's right to be protected against these diseases. So it's incumbent that the country have a law that says we have to buy these vaccines for our children, to protect our children. It's now a law. What better way to sustain a program? So once the vaccine is introduced, then there's a law stating that the government must pay. And our data show that virtually every country, with exception of Haiti, but even Haiti buys some of its vaccines, but virtually every country purchases about 95% of its national vaccine supply. So sustaining introduction of these new technologies that are essential to achieve things like the Millennium Development Goals, having the evidence to make an informed decision to introduce the vaccines, and then the capacity to absorb them. So cold chain, human resources, training, logistics is all also very, very important. A plan of action, so the vaccine is not wasted. So you have a plan, you know by community, by neighborhood, by health center, how much vaccine is needed, what kind of human resources you need to be sure it's properly managed, what kind of cold chain. I know in the case, I use this example a lot, one of the new rotavirus vaccines, when it first came out, was a single dose package, and the package was about the size of my palm. So a 20 dose vial of measles vaccine may be this size. So one dose of this vaccine, you imagine what that does on that little refrigerator in a village in Guatemala. And so there are enormous implications on how you need to plan, both at the community level and then all levels back up, so that you have the capacity to store and manage those new vaccines. And I think that one final thing I'd like to add to this is that it's not vertical in the sense that the examples I'm just citing sound very vertical: cold chain, sufficient operations to manage this new vaccine. But it's all integrated in a primary healthcare approach. It's all part of the services that you would provide when a mother comes in for high blood pressure. You're asking her about the immunization status of her child, or her tetanus. When was her last tetanus vaccination? So it's grounded in those kinds of guiding principles that I think contributes to a broader base of healthcare services. Self-sustaining in the sense that I think the easiest example to cite is one where the government covers the costs. That's ownership at its best. Self-sustaining in the sense that you don't need external resources. You don't need a consortium of partners to provide the support required to vaccinate in that program. Because there are too many uncertainties. How long is that donor support going to last? What happens when funds dry up? So those vaccine laws that I mentioned, if that is ingrained in the national budget, that becomes a law. I think I can't think of a better way to sustain a program, whether it be immunization, whether it be primary healthcare services, the approach to control of tuberculosis, other public health priorities. The more government ownership, those things that contribute to good governance, that make health a right, basic package of services, I think, are essential, and the more that local governments can take ownership and coordinate and manage, that would be, in the best of all worlds, the best self-sustaining. And it doesn't always happen, even with vaccine laws. Our role is to, through difficult times, provide technical cooperation. So PAHO is not a donor organization. We provide technical cooperation. We try to bring together the best science, the best experts to support countries with critical issues that they face.